Hi, Peter. How are you?
Hey, Anna, how are you? I'm very good. Thank you.
Good, yeah, thank you. So we're popping on this call to talk a little bit about what ELDOA is and the certification, the upcoming certification we have in a month's time here in Brussels.
Yep.
Exciting stuff. And
Yeah.
so talk to us a little bit about ELDOA, what it is for those who are not familiar with the therapies that might not be familiar with it, or anybody else who's in the field of movement.
ELDOA is a posture normalization exercise where we're using our own connective tissue tension in order to create opening in targeted joint segments. Okay, so in very simple terms, there are a bunch of ELDOA exercises for the spine, specific exercises for different pathologies of the spine. There are exercises for the hip joint. There are ELDOA exercises for the sacral leg joint, pubic symphysis, the costal transfers, sternocostal articulations, the clavicular joint, acromioclavicular, sternoclavicular joint, and the glenohumeral joint. These are the main categories of the ELDOA exercises. In our training in February, we're basically going to focus on the general spinal ELDOA exercises. So taking it, starting at the level of L5S1, so the lumbosacral junction, and gradually, methodically work our way up all the way to the base of the upper cervical spine. So to C2-3. So we're going through all these segments. What's going to happen in this course? So how this will play out? Um, Normally, the course is starting with an introduction, history of the methodologies that contributed to the conception of the ELDOA by the creator, Guy Voyer, who was a pioneer osteopath and fascial expert when it comes to tensegrity biomechanics. Little diving into these techniques, what contributed to the ELDOA, and his experience with these techniques and how he came about creating this complex system, followed by anatomy and biomechanics in relation to the spine. And then we're going to put this all into practice. So what's going to happen is, again, you learn by doing. This is one of the big motto. So we learn by doing, relating the anatomy and the biomechanics in a practical session to each and every position, experimenting with each other in the sense that we are exploring the connective tissue tension with different movements. And the concept of the ELDOA is a very new kind of concept in the sense that, regular muscle contraction. So the ELDOA is an acronym for a number of posture normalization exercises where we use our own connective tissue tension. We are all muscular effort to target the opening of certain joint segments throughout the body. These joints are mainly in the spine that we focus on, but it can be also in the hip, in the joints of the pelvis, sacral leg joint, the pubic symphysis, joints of the rib cage, so the sternocostal articulation, the costal transverse articulation, and the joints of the shoulder girdle. So it could be the acromioclavicular joint, the sternoclavicular joint, together with the first rib and the glenohumeral joint. So basically, these are the major ELDOA exercises that we use, that we basically detail in our certification program. The concept is basically we create a fixed point and we create a moving point. In any kind of muscle contraction, you have the two attachment points of the muscle in order for the movement to occur. One is fixed and the other one is moving towards each other, normally in shortening. In the ELDOA, it's a little bit different because we have the fixed point, but the moving point is moving away from the fixed point. And how we manage this is by specific uh, directional movement in fully engaged myofascial tension. So when we're talking about fixed point is being an inferior segment of the spine. Let's say if you like, we can get right into it. We're looking at the course that we're going to do in a month. That's going to be a level 1 and 2 ELDOA course. It's going to focus specifically on the spinal segments from the lumbosacral junction all the way to C2-3. So the concept is that we fixate the inferior segment and we mobilize the superior segment. We fixate the inferior segment by engaging the lower limb mainly in a specific posture, soliciting the myofascial chain in relation to that inferior segment to create a fixation. And we do the same with the superior segment via the trunk, so via the spine and via the upper limb, and engaging specific effort to move the two away from one another. So if you ever seen a photo of somebody doing an ELDOA, it can be quite deceiving because it's quite an effort. It's quite an effort. It's an extreme range. So it's a very, very much in a stretchy range, eccentric muscle contraction, right? And there's numerous benefits to it. So which we obviously go into detail in the course, but just to name a few, you get a global normalization of myofascial tension and create a balance between the different chains. But intrinsically, you're actually opening the facet joints. You create a little opening. You're creating a little tension on the capsular ligament and the intrinsic ligament between the segments. The proprioceptive stimulation of the deep paraspinal muscles. So if you think about the multifidi, think about the short rotators, the long rotators, etc. Stimulation, mechanical stimulation of the intervertebral discs, which actually induces a metabolic stimulation of water intake. So basically, the imbibitional disc is going to be improved. So your water uptake of the disc and the water exchange, because the annulus fibrosus is also fascial tissue. Benefits of the ELDOA is targeting a joint segment where you're creating an opening of the articular surfaces, so the decompression of the sort of articular surfaces. You're creating a little normalization of the ligaments, the capsular ligament and the intrinsic ligaments between the vertebra. You are creating a proprioceptive stimulation for the deep paraspinal muscles, the multifidi, the short rotators, the long rotators, and semispinalis, etc. It's in an extreme range. So basically, it's going to give a very good postural stimulation for the whole system and the brain. Not to mention that it stimulates your improved circulation, arterial, venous flow, lymphatic flow. It will be looking at a parasympathetic trunk that's sitting right in front of your vertebra. It's going to give a stimulation to it. So there's numerous benefits. Structure govern function. So it really much goes with the traditional osteopathic concept. And, obviously our main target is going to be the musculoskeletal system. But if you start looking at more like how each vertebral segment is relating to the innervation of certain structures, whether it's musculoskeletal or visceral, how the different visceral attachment points are relating to the visceral is relating to that specific spinal segment that we are targeting. So it goes into more detail of how the whole system can benefit via the normalization of the basically the spine.
Mm-hmm.
So the online sessions are going to be 3 evenings, roughly 2 to 3 hours each. It's an interactive session, so it also depending on how interactive the group is. Starting with the introduction of the ELDOA, the concept of the ELDOA, where the ELDOA originates from. It was created by a pioneer osteopath called Guy Voyer. He was an osteopath, an MD, a physical education instructor, and he was a specialist in. He was an anatomist, so he was a specialist in fascial anatomy and biomechanics. So it's really much his creation, and the first part of the theory we're going to how he come about creating all this together, from exploring what kind of techniques he studied that inspired him or got ideas from, going to his experience as an anatomist and in dissection, and how he started using ELDOA when he started using ELDOA back in the days, and how he applied it all the way through from patients to professional athletes to average people, right? So that's the beginning. Following that, the second session will probably focus most on anatomy and biomechanics. So the course assumes a base level of anatomy, but we're going to just dig a little bit deeper into how this anatomy relates to the ELDOA, and adding a lot of different links to our knowledge of anatomy that will help us better conceptualize as well how with this global tension is actually creating this pulling forces on the spine that will create the effect that we're after when we're performing the ELDOA, right? So we're talking about the connective tissue. We're talking about a little bit of tensegrity biomechanics is what we're going to put it into practice. So it's all going to be the preparation for the practical session, right? During the practical session, we will jump back into very shortly on some of these presentation slides to really help all the participants to put it in place and give a different understanding, to visualize the anatomy. That's a really important thing, that because when we get to Saturday, the practical part is basically going to be an ELDOA marathon, meaning we're going to go through a lot of different positions, and it's nice to have create a little system in our mind of the principles that we need to follow in order to understand how we are able to create tension in different positions and how those positions relate to those segments, right? And obviously, it's a complex technique. So the way of teaching is also going to be more in a style of more problem solving. So we're creating a foundation to each posture, and then each and every participant is going to with specific directions explore the connective tissue tension of the person that they are working with, because everybody is different. There are different morphotypes. There are different abilities, both physically. So the range of motion, somebody is stiffer, somebody is much more flexible. There are different channels. Each end of the spectrum shows a different challenge. And also there's a different ability to process the information and to be able to control the postures as well. So we need to take this into consideration and focus on how we can progress and develop different progressions and regressions for different population, different people. And when we have a nice group, not usually the big group presents itself with different challenges. Somebody has a rotator cuff injury and cannot lift the arm up. Somebody has a herniated disc. Somebody has sciatica. Somebody cannot kneel, cannot sit. So how do we create different progressions to be still true to the principle of ELDOA, with the intention of developing the awareness, the sensation, and working the person towards a final stage, which will be a full ELDOA posture at the end of the journey, if that makes sense. Okay. Obviously, it's very conceptual as I'm talking about it, but it's a nice few days of a different level of stimulation and a completely different style and type of physical effort that you make that your body is absolutely not used to. It's just a shocker for everybody in a good way. In a good way.
Yeah.
Because
Yeah.
there's not many techniques out there that you can do yourself, and you can give yourself an immediate relief from pain. You can give yourself a postural stimulation that will completely change your the way you move and can change the way you move, right? And so basically the questions I always get asked is like, who should be doing this course? And obviously our goal is to attract as many professionals as possible, right? Because this is not only going to give you an edge to your practice, but this is truly going to uh, give you tools to be able to make big changes to your clients and patients in a relatively short
It also
time frame.
evolves the way you think in terms of treating patients and how you see the body as a whole,
Well, completely
and
different,
not just, yeah.
yes, because while we're being really specific on being able to isolate different parts of the body and be very detailed with anatomy and biomechanics, we're looking at the relation to the whole. And your body is only as strong as its weakest link. So if there's a weak link, there's a sore spot, there's a weak link in terms of mobility, or too mobile, too stable, painful. Uh, that's always going to determine and affect the rest of the body and how it moves. So we're going to address that as well. Like this is the concept.
If I can just say, having the experience of doing the program a few years back,
mm,
um, not only you're putting yourself in a position that you start to think and to problem solve something you're not quite used to doing, because usually you have protocols, you take the protocols, you do what you do, but here you need to start thinking in a different way. So that's one aspect, and then you have a lot of practical, but then on the other hand you do it yourself, so you experience the ELDOAs, and it's such a different sensation from doing any other sort of exercise or stretching. It's so invigorating, it's very revitalizing for the body. So having the experience yourself as a practitioner in that certification program is another eye opener as to what is possible.
it's definitely, so the whole course is basically um, everybody is going to be paired up with somebody else, and then this pair is going to change because they're going to be different body types. And so you go through the experience of coaching and observing and coaching and learning that way, and then you're going to be coached and observed. So the two goes hand in hand, and then it's going to help you with your ability to be able to do the exercise will help you with with coaching and vice versa. So meeting different body types, hopefully a lot of different body types in a course. It always happens like that, but depending on also the course size. We have all sorts of people coming from different backgrounds, from chiropractors to physiotherapists to Pilates instructors, yoga teachers, personal trainers. Sometimes clients wants to do the exercises, want to learn the exercises for themselves for the better care. So it's usually interprofessional group. So different people have different strengths and weaknesses. So obviously for the for the coaching, the trainers and the instructors may have an advantage, while the therapists will probably have more advantage in the palpation part and the anatomical side of things. Um, as we go and progress through all the postures, we're actually going to palpate the spine, and then that's how we're experimenting with how the different positions and different angle of tensions, different planes of tissue will create that little movement between the segments. So it's quite fascinating and very interesting, I should say.
Mhm.
Right.
Indeed it is, yeah.
So that's
Definitely
basically
for me, it's changed the way I look at the body, but the way I feel my body, the way that I teach, it was life changing. And to know
as
that before, always felt that I was having a stiff spine, even though I was a yoga teacher, and no control, getting hurt very easily, um, always needing to be adjusted by a chiropractor. After I started practicing ELDOAs, and doing the exercises, I didn't need a chiropractor anymore. And now the occasional osteopath from time to time, just to make sure everything is in order, or if you overdo it sometimes with whatever activity
Mhm.
you do.
Mm.
But yeah, it has really made a huge difference. And with the people that I work with, likewise, like back
This is this
pain.
this this is a great technique that you can use it as an assessment tool. You can use it as a recovery tool. You can use it as a rehabilitation tool. In fact, it should be used as a recovery tool all the time, and also a preventative tool, right? As you're mentioning it, well, everybody has some sort of spinal issue, whether we're aware of it or not, or the restriction of mobility in the spine will be affecting how they move. At some point, many people will have pain. A lot of the time, this pain resolves on its own. A lot of people will have recurring pain, but it's really about if you lose your spine, you lose your actually the entire health will be affected. So maintaining spinal health, and it goes beyond that as well. It goes beyond as well because once you start addressing specifically with intention the connective tissue, with movement, and with different ways that we're going to be talking about during the course, that's going to have a major impact on everything: how you do your digestion, how you sleep, your psychological state, your sense of well-being, and so on. So it's a great course, and it's a really nice intro into the whole Soma world, almost whole Soma program,
Mm-hmm.
because you're starting to see again like how these principles of micro movement manage macro movement happen, right? The structure governs function. Quite often we have people coming in and walking out of a course with quite a bit different posture, right?
Mm-hmm.
So it's really nice to see. And while you go to a workshop, and you usually what the experience is that you're learning in a weekend 5, 6 techniques, and then it's going to be really spelled out and served on a silver platter for you, and very much almost just want to make sure that you're understanding it 100% right, which is there's nothing wrong with that. On the other end here, we are focusing on getting them in the understanding and the concept, and focusing on all these exercises, and you're going to have so many tools that you start using the next day that it's a different experience. It's going to be lots of information
Totally.
to
Yeah.
yeah. So that's
Mm.
basically what's going to happen. I'm looking forward to seeing everybody who is interested, and yeah.
Looking forward to having you.
Yes. It's going to be fun in Brussels.
Cool.
Hopefully lots of therapists, lots of trainers. Again, so
Yeah.
who is benefiting from that is going to be any sort of. By the way, this is also worth mentioning. This is really nicely going to be. You can combine with other modalities. So you can do your Pilates or yoga class, and you can do the few outdoor postures at the end, which will be very beneficial. You can you should do your personal training, your weight training, your athletic training session, whether it's on the field or in the gym, and you do a couple of outdoor postures at the end to offload it, the spine. Uh, uh, you are if you're a therapist in between treatments, ELDOA is a great tool to address those structures that you may have treated throughout the session, and for to integrating those in an active manner. Those uh, positions will be
Mm-hmm.
very beneficial for clients and patients. So it's a really wide range of applicability, and this is one of the techniques that stays with you to different ways, different forms throughout your whole. So you can start at the rehab stage, and then you come out of the rehab and go into more training and athletic training and maybe competition. That will be staying through with you, again in different intensity, different postures, different ways.
Mm-hmm.
Uh, First as a as a rehabilitation, then recovery tool, and then preventative measures. Yeah. So
Mm-hmm.
This is it.
But also enhancing performance in a set. Say you're, I don't know, you're lifting, you're weightlifting, and then if you're doing the ELDOAs, you might find or create more thoracic mobility, more spinal elongation, let's call it that way. So you don't have so many compressive forces on your spine, and then you can mitigate injury or not get injured. But you could also use it as a recovery tool when you finish your lifting. You do ELDOAs to decompress those parts that might have felt a little bit compressed during your training or your workout. So
So if
such
you
a
improve
wide variety of
improve
application.
the motion goes through your body and shared between different motion segments from the moment you hit the ground with your heel, and it travels all the way up, the weight of the body travels all the way down, um, and then this motion is and this stress is shared between the different segments. If one segment has excess mobility or lack of mobility, the segments above and below have to compensate for it. So if I improve the mobility of a restricted segment, the segment below, including the disc, including the how the ligaments and the muscles work, will be different. So nice smoother movement and distribution of forces through the body. On the other hand, if a segment is unstable, we have to use this to offload it and stimulate it and to nourish it. And then there'll be other techniques to use to stabilize it, right? So again, it's a two end of the spectrum between mobility and stability. Different way of applications and the program design,
Mm-hmm.
but both of them will be using the ELDOA,
Yeah,
right? I
good
look
stuff.
forward to seeing everybody. And
Yes, we too. Take
cool.
care.
Thanks, Elena.